surgical robot is basically a mechanical and computerized interface between the patient and the surgeon. The robot allows the surgeon better visualization, which is the main and the first benefit, and then better manipulation, all through minimally invasive access points in the abdomen. That's mainly where we use the Da Vinci robot here, is in the abdomen. Different specialties use it for many different procedures, but all of them are done through tiny little holes that are just big enough for your finger to go through. Just yesterday we were doing a case where we found unexpected finding of stones outside of the gallbladder down in the bile duct in a patient that would not be able to have those stones removed through traditional through-the-mouth technology. So we were left with a dilemma. Do we open the patient and do old-fashioned surgery, or do we continue with our minimally invasive surgery? Because we had the robot, we were able to advance a secondary scope down into the little tube where the stones had escaped and remove all of those under direct visualization and close off that opening without doing any more cutting on the abdominal wall or skin. When you say traditional, I assume you mean open surgery, and any minimally invasive surgery will be much better tolerated with a faster recovery. Many of the procedures we now do with the robot allow the patient to go home within 24 hours of the surgery, which is much faster, and then they have a much faster return to work and their normal activities even after the recovery at home. A robotic surgery truly shortens the recovery period from weeks to more like days. And so most patients are really happy to be able to have the robot to have those smaller incisions and a quicker recovery. All the pain that the patient experiences is from the access points through the abdominal wall. And these are fairly small incisions, 8 millimeters to 12 millimeters, that allow us access ports for the camera and the different robotic arms, which truly gives the surgeon 3D vision. Here at Timpanogos, we are performing, for general surgery, a lot of diaphragmatic hernia repairs, procedures for patients that have bad reflux disease of their stomach up into their chest or esophagus. We can do splenectomies, remove tumors from the stomach or from the colon, so we're doing colon cancer surgery. It can be used for rectal procedures as well. And then the GYN surgeons are doing a lot of hysterectomies right now with this. And then the prostate cancer surgeries are being done by the urologists. The Da Vinci robot is basically just an octopus that holds surgical instruments for the surgeon. The surgeon still manipulates and uses his own hands to move the robotic arms. We can switch back and forth between the different arms of the robot so that we can have one arm stationary and holding tissue, while we can then switch and use two more to do dissection. One of the neat things about the robot is it can move and articulate in ways that the human hand cannot. With laparoscopy, which is also minimally invasive surgery, most of the instrumentation is on a straight stick, and it will allow grasping or cutting at the end like this, and also twisting at the wrist. The robot, it has an elbow as well as a wrist and fingers, and so we can move the instrument in ways that we can't move laparoscopic instruments. The surgeon can use that to finely dissect areas in funny contorted angles that he wouldn't be able to do any other way. One of the other really neat things about the robot is you can scale it so that if the robot moves, well, so if your surgeon's finger moves, say 1 inch, you can scale that to be 1/2 of an inch internally for the robot's work. I've been involved with robotic surgery for a few years now, and where I came from in Denver, we had the urologists start as the first specialty that really took this on for prostatic cancer. And now, almost every prostate cancer patient desires a robot over a traditional surgery. The same is now happening with hysterectomy in the gynecologic surgery arena. Well, I think that Using the robot is exciting on a lot of fronts. Most of the patients that have the robot are really excited to have it done, but the main thing is better surgical outcomes with less downtime or inflicted recovery pain time. So that's the thing that excites me the most, is having the patients happy, excited, and get better.